Whenever we encounter this condition of amblyopia in the infants or even in the children of the older age group, that is mostly the children under 12 years of age are suffering from these amblyopic kind of conditions. Now, as early the diagnosis would be, as better the prognosis would be in these particular children. So again, the correct diagnosis at a very early stage is the mainstay or the baseline for a better outcome in a patient, making the patients aware of this condition, spreading information regarding these amblyopic conditions, the causative factors towards the development of amblyopia or a lazy eye in the child is again very important over here. So there are the different causes that we are encountering, and treatment would obviously depend upon treating the underlying cause. First of all, if the cataract is responsible for the development of amblyopia, we have to treat cataract. If it is strabismus that is resulting in the amblyopic condition or a lazy eye, we have to treat strabismus in a particular manner, may it be the surgery or whether it can be the eye drops or the correction of the refractive index by the wearing of the lenses, or it can be a patchy eye treatment that we're dealing with. So these are the different ranges of treatment modalities that are available out there to treat this condition, which is basically known as or categorized as amblyopia. The guidelines would be discussed over here. We'd be not going into the details regarding the specific surgeries of the cataract or the specific surgeries of the strabismus, but it would be basically the guideline treatment that we usually encounter whenever we have a patient of amblyopia at our hand. Then we will be basically categorizing the treatment into two broad modalities. That is, first of all, we have the non-surgical kind of a modality, and on the other hand, we have the surgical modality for treating these patients of amblyopia over here. The treatment would consist of lenses must accommodate to see the relatively distant objects whenever we are focusing on it. The relationship between how much we accommodate and how much the eyes converge is again very important, that we are helping the eye to accommodate properly. We are correcting the refractive indexes on the other hand as well. The patients with accommodative esotropia accommodate so much that their eyes overconverge, or there is an esotropion or cross-in phenomena that is observed over here in these children due to the accommodative errors. The patient attempts to fixate the X, basically the fixation test, or which we perform and which is also known as a binocular fixation test that is performed. The patient is asked to fixate the X, that is a distant object basically. Each lens must accommodate to see the object, and the relationship between the accommodation and the convergence, eyes will converge, is based on the amount of the accommodation. Eyes will over-converge depending upon the accommodative reflexes or depending upon the refractive errors that are found in both of the eyes. So the level of the anisometropia is basically defining over here how much over-convergence we'll observe in this particular child. The accommodative esotropia is basically, it can be treated with glasses in a lot of children. So if there is some sort of a problem with accommodation, or if there is some sort of a problem with refractive indices, we have to basically make the binocular vision more appropriate for the child without the refractive indices. So the spectacles or the inculcation of the glasses is the treatment of choice whenever we are talking about the accommodative esotropia in the children. Anisometropic amblyopia. On the other hand, we have the anisometropia. It can be corrected with glasses as well. The image degradation amblyopia is one of the phenomena when we are talking about the anisometropic amblyopia. Another name for this condition can be the image degradation amblyopia, because there would be a confusion of the images in both of the eyes. The messages sent to the occipital lobe would be confused out there, and the final conclusion would be a blurred image in these children. The cataracts are removed by removing the lens, and an intraocular lens can be implanted in these children as well. Severe ptosis can be treated surgically. So, if ptosis is the causative factor for the development of amblyopia, we can perform the corrective surgeries. As you can see over here, there was a significant ptosis in the left eye that can be observed in the before situation, and after the surgery, there is a complete correction of the ptosis in the eye. In some cases, the amblyopia will resolve in response to the spectacle correction only. On the other hand, in more severe cases, the subjects must undergo the occlusion therapy as well. The unaffected eye patched to force the use of the previously deprived eye. So the baseline or the guidelines for the treatment modalities would include the use of the spectacles to correct any refractive indices errors in both of the eye or the difference in the refractive indices in the both of the eyes. On the other hand, we can perform a lot of surgical procedures for the causative factors. We can perform the cataract surgeries. On the other hand, we can perform the ptosis corrective surgeries in these eyes. If there is some sort of a corneal abnormality, if there is some sort of a retinal abnormality, we can treat or we can address this retinal abnormality in detail, and that would result in a very good outcome. I would focus on this fact that the early diagnosis is again very important. You can inculcate exercises only, you can inculcate eye drops only, and you can avoid these surgeries whenever needed in specific cases. So the correct diagnosis at a very early stage is again the mainstay over here, and the final aim is to correct the final image formation in the child. Patchy eye treatment is one of the most effective treatments that are given to the children. The outcomes are amazing in these children, so usually it is the most effective treatment and the most common treatment that is given out there to children to treat the lazy eye. A relatively new treatment is to provide patient with levodopa. So when we talk about the drugs, levodopa is one of the newer treatments that are devised nowadays. Levodopa is metabolic precursor of dopamine. The L-dopa may establish the period of plasticity in the visual cortex, as we've already focusing on this fact that it's a visual developmental disorder. So whenever there is a period of plasticity, it is going to reestablish it in the visual cortex, and that would be the mainstay over here. It allows the cortical cells to be open for the formation of the new connections. So over here, you can focus on this fact that it can be the drugs only, and the experimental drugs out there nowadays are the dopamine, and on the other hand, we have the levodopa as an experimental newer drug that is devised to treat these amblyopic conditions. So over here, we focused on this fact that the treatment modalities can range from the medical treatments only, which includes the eye patchy phenomena. On the other hand, we have the drugs that are inculcated. We advise the patients to perform a lot of exercises if the eye is weak enough or if the extraocular muscles are weak enough. On the other hand, we have the surgical modalities. We can correct the cataracts, we can correct the ptosis if they are severe enough. So it depends upon the patient. We are going to weigh, or we're going to design the treatment plan according to the patient in this particular case. The outcomes again would depend upon an early diagnosis. But we have to focus on this fact that if this condition is left untreated, it can be quite devastating for the child. It can result in a severe decrease in the visual acuity, and finally, or if left completely untreated, it can result in the total blindness in the child. So that is the end of the section. Thank you for watching Skydia.com.